Let's now welcome agricultural expert Wandile Sihlobo. Wandile, very good afternoon to you and thank you so much for your time. So the ministry is now hosting this two-day Indaba. The minister, as you've heard in that clip, calling for a deliberate and sustained investment to be made to reduce the spread of animal diseases. Based on your assessment, what are the biggest structural or even policy blind spots, do you think, that are currently hampering maybe South Africa's ability to manage this foot and mouth disease?
I think, Unati, the starting point may perhaps even to help South Africans appreciate how important this sector that we are talking about. Because when we think about the livestock industry, it accounts for roughly half of the South African farming economy. So it's an important component, which means then when there are challenges there, that presents challenges across the South African farming sector. At the moment, the key challenges that we seem to be battling with is our ability to be able to manufacture the vaccine, the surveillance, monitoring, and I would say some of these are even outside the Department of Agriculture, which has to do with the fencing in rural areas and certain areas that we know that they are prone to some of these disease outbreaks, so that the movement of animals can be fairly contained and well managed. And therefore, when we have unfortunate situations like today, we don't get to 100% rely on the likes of Botswana or for these vaccines. We really need to make sure that we kickstart our own capability. The important thing here, Nadi, is that we are not a country without the scientific capabilities or the amount of willing partners. We just lost the capacity in the state-owned institutions, which in a way you could argue it was part and parcel of the state capture days. Right now, then, it's that revival that the minister is talking about, which I would say it must go deeper to vaccine manufacturing. And that core investments, it has to also cover that area, in my view.
When you speak of the sector also being very fundamental and important, and many would agree. But when you look at just some of task teams that have been, set up, there were recommendations, for instance, made following that 2022 task team report, calling on a number of issues, including the National Animal Health Biosecurity Plan. Have any of those been implemented or even taken seriously enough?
We as a country have been very slow, Unati, on implementing some of these plans. We are famous for being known as a country that always have great economic plans, but limited implementation. We say that when we survey and observe the national picture, but that rings true also with the agricultural sector. Under then Minister Togo Tidiza, we faced a very difficult situation where about 6 of our 9 provinces had an outbreak of this disease. That is in the period between 2022 and 2023. And at that time, we also saw significant losses in terms of the export revenue and just the general business activity in the farms, which then led to that 2022 report that came out recommending about what needed to be done. We have been slow as a country on implementing that, and I hope now then that the new task team that Minister Steenhuisen is putting together and the grouping, and as well as what will emerge tomorrow in this conversation in the north of Pretoria, will build on some of those points because they are still relevant today. Because here, Unati, we are not only talking about saving half of our farming economy that we have, but we are also looking at a sector that is one of the most inclusive when you're thinking about the medium and small scale black farmer participation. But not only that, when you think about the capacity to grow, it is also one of those sectors that can still grow and grow robustly. And that involves managing the disease spread, but also making sure that we invest enough so that in future we are a better place to deal with this.
And just on that point, I wanted to just want you to expand a little bit on it. Just from an economic standpoint perspective, how do these repeated foot and mouth disease outbreaks then affect these smallholder and black livestock farmers, especially when you compare them from commercial operations?
Look, I think the economic pain is there for everyone that is in the sector, and perhaps even more severe for the commercial players. But what assists some of the commercial players is because some have ability to borrow and then have a little bit of time to recover. But if you are small, you may not have those flexibilities, because the challenge that you face is that if you are affected and then for a particular period you can't slaughter, the foot and mouth disease does not necessarily kill cattle. And now you're stuck for maybe 1 or 2 months with cattle, which you need to feed 3 times a day. And that costs money, and you can't slaughter for that period. That's the one aspect. For small and medium scale farmers that usually sell their cattle in auctions, selling to certain feedlots, now with the limited movement of animals, as well as just the risk of a disease spread, that makes everyone to be extra vigilant. That means then that those markets dry up, and that causes all of these difficulties, which is why I think perhaps as a country, we may have to reach a point where we ask ourselves, is it the time for South Africa to start applying a widespread national vaccination approach when it comes to foot and mouth disease like the South Americans do? And I think that's one of the conversations that as the industry as well as the government we must actually look at, because the reality is that we are seeing these outbreaks happening much more frequent than in the past. And I think we must change tact on that, because at the end it is very costly, and of course this also weighs on jobs in some of these rural communities of South Africa.
Yeah, and speaking about changing tact, and as we wrap our conversation, what timelines then and measures would you recommend to ensure that, you know, the discussions at this Indaba result in measurable action and not just another task team?
Unati, sitting part of the audience in this task team and also participating, the conversations are still ongoing, and tomorrow they will continue. We are here north of Pretoria. But my sense is that so far, from what I have heard from various people, because here we are also dealing with the scientific matter, is that everyone wants to see a different approach, and the one that is long lasting. And I think the minister's points that he alluded to today speaks exactly to that, which is one, the private sector involvement across a whole range of aspects is necessary. And I would say then, in a vaccine manufacturing, even for FMD, we may need to use some of the vaccine lab that may be devoted onto this, so that we have the capacity to manufacture. And the secondly, I do think that the conversation with related departments, either it's police, it's public works, it will also be necessary. But I think the conversation is moving to the right direction, and hopefully then by tomorrow we will be able to have that clarity, encompassing views of all of the important stakeholders that are sitting in here and deliberating about this important sector of our economy.
Well, we'll look forward to that, and of course we'll touch base with you just to see about those measurable actions. Wandile, thank you so much. Always a pleasure speaking to you. Agricultural expert Wandile Sihlobo there for us.